A new landmark study is projecting a 187% increase in people living with dementia by 2050. The report also looks at a major shift in dementia demographics in this country. To discuss the findings is Dr. Roger Wong, Alzheimer's Society of Canada board member, clinical professor of geriatric medicine at UBC. Good morning. Thanks so much, Doctor, for taking the time to speak with us about this study. Really important numbers. The study finding that the number of people with dementia will skyrocket by 2050. Why is that?
Yeah, this is one of the most important studies in the history of Canada when it comes to dementia care, because it is with Canadian data and done by Canadian researchers, and most importantly, with implications for all Canadians. There are multiple reasons why the numbers are rising. As you have mentioned before, the number of individuals in Canada from coast to coast to coast who are living with dementia is projected to triple in the next 30 years. Multiple reasons. Population is aging, the presence of different risk factors that will lead to dementia, some of which are modifiable. And so there are things that we can do. But more importantly, what we need to do is we have now arrived in this pivotal moment, this moment in time when it comes to dementia care, that I believe when we make all the right choices to take the right actions now, we can collectively improve dementia care for everyone across Canada.
So how do we prepare, Doctor?
I think there are 4 different ways that we can think about it. The first thing is, in terms of our healthcare system, we need to ensure that there are policies in place and implementation of these policies to allow for equitable access to dementia care, including diagnosis and prevention for all Canadians in ways that are culturally sensitive. The second way is through research. We need to ensure that research on dementia in Canada would include participants from very diverse backgrounds, because they make up the population in Canada. And the third way really is to think about policies that will reduce differences in dementia risk across Canada. And that would include policies to allow for national data collection and tracking. And fourth, and last but not least, is to make sure that there is education and support that is again done in culturally sensitive ways to support persons living with dementia and their care partners and loved ones.
The report highlighted the fact that the Asian population is really going to be impacted. Can you expand on that? Tell us why.
Absolutely. So what this report does is to look at individuals from different cohorts and different groupings. And there's a discovery that for people with Asian, including South and East Asian ancestry, that the number of individuals living with dementia is projected to increase by 9-fold. So a 9-time increase from about 40,000 people plus living with dementia right now in Canada to over 400,000. So it's a significant jump. Again, multiple reasons. The population is aging, but there are also the presence of risk factors that lead to dementia that are seen especially in this population. The other thing to remember is there's also a lot of culturally sensitive values, attitudes, beliefs, or stigma that could become barriers in terms of these individuals accessing care.
Doctor, I have to ask you, in just going over the report, we know that most people who have dementia, and dementia is an umbrella term, are older, but is age itself a risk factor?
Yes, we know that age itself is a risk factor, not the only risk factor, and obviously it's not modifiable. But we have also learned in terms of young onset dementia, Canadians who are under the age of 65 who develop dementia, the numbers are also in the rise. And this is also very concerning because individuals who are living with young onset dementia, including the most common cause, which is Alzheimer's dementia, will face different and unique challenges, not only in terms of health, but also in terms of their work and employment, and in terms of their own role in terms of caregiving. For example, they may look after older adults as parents and grandparents and their own younger children. So the impact on these individuals living with young onset dementia and their families are very unique and require immediate attention.
Dr. Roger Wong with the Alzheimer's Society of Canada, thank you so much for your time with us today.